questions. I know that I went very, very quickly through the slides, and there's a wealth of information about the whole NIH process. So I'm happy to answer any specific questions that you might have, or provide any additional information on any specific topics. So please let me know. I figure this is the Q&A portion of the conversation. And if you don't want to come off mute, if you have concerns, I'm going to open up the chat, and feel free to put it in the chat, but love to have this as a conversation. We can actually pretend like it was in person.
Thank you very much, Dr. Fertig. My name is Eunice Yang. I'm the CEO of OK to Stand Up. The question I have is with regards to partnerships and also contractors, do they have to be within the US, or can I collaborate with my colleagues in Canada and contract out the work to offshore?
That's a great question. And this is actually something that is shared between the different agencies. The work really needs to be done within the United States. Okay. And there are rare instances where we do allow for work, a portion of the work to be done outside the United States. However, you do have to show that it cannot be done in the US. And so for NIH, the example that we often point to is, say you're trying to do a clinical trial and it's on a rare disease. The population in the United States may be too small for you to actually do the full clinical trial that you wanted to do. And so you may need to go outside the US to make sure your patient population, you have the right numbers for your clinical trial. So that's an example of a situation where it's impossible to do that in the United States, and so you're going further afield. However, if you are seeking to do work outside the United States, you really do need to show that that barrier is reached. So I've been working with someone for a really long time, unfortunately, is generally not appropriate justification. You really have to show that there is no other option than to go outside the United States.
Okay, thank you very much.
And I should also mention cost, also not reason.
Okay. All right, thank you.
Stephanie, I have a question. Is it possible to migrate from phase 1 STTR to phase 2 SBIR? Or...
Absolutely. Okay. Absolutely. You can change between the two. So you can go phase 1 SBIR to phase 2 STTR, and you can go phase 1 STTR to phase 2 SBIR. That is actually a flexibility that we do allow. And we even allow that movement for our phase 2B programs. So say you've used STTR all the way, and then you want to switch to SBIR for a phase 2B, that's often allowable as well. And so again, we do provide that flexibility, because what we really want you to do is utilize the best program for your company and for your technology. Many of our SBIRs, by the way, do have partnering. Very common to have partnering in our SBIRs. But you know, the SBIR and STTR, they have similar scope, similar review criteria. They're reviewed in the same study sections.
Okay.
But it's really about what structure works best for your project.
Great, thank you.
Stephanie, I have a question in regards to collaborations and clinical trials. And if you are going to perform a clinical trial, do you feel that the application is stronger if you do a STTR with a university partner, or it really, you know, doesn't matter? It depends on who is all on your core team.
It really depends on the project. And that's I think there, and this is, I'm just going to speak in generalities, actually. I do hear from a lot of people that they have concerns that, look, I need to have an academic partner. Not necessarily. It really depends on the strength of the overall team, right? I mean, what makes for a good proposal is having the best team to accomplish the project that you're proposing. And so, and it's interesting. And the other question, I'm going to start guessing questions too as we go, like try to answer questions that I know have come up in the past as well. But you know, one of the questions I get a lot is, well, what are the qualifications for a PI? Does a PI need to have a PhD or an MD? You know, what exactly does the PI have to have? And about seniority for, you know, how what does the PI's, bio sketch need to look like? And it's interesting, we've supported individuals who don't have PhDs. We've supported individuals who are fairly junior in their careers, but have a great technology. The trick is building that team, right? They're bringing something to the table, but they're also putting around the technology the appropriate team to make sure that innovation can move forward through the product development pipeline. And so I would really encourage you, when you're looking at it, think about the team, who fills in the gaps for, because every company has gaps. Okay, so I'm going to start with everyone has gaps in knowledge, right? That's okay. Making a strong proposal is bringing together the individuals who have that other expertise, who complement you, and that's what makes a great proposal. And I've seen that work really well time and time again. I don't know if that answers your question, but there you go.
No, I did. And I have a follow-up question in regards to preliminary data. And since given that, you do have to have a certain IRB in place in order to test certain technologies, I guess, how do you guys gauge the preliminary aspect when submitting an application if, there's already like that guard or barrier in the beginning to test?
That's a great question. And that's a question around preliminary data. And particularly when you're talking about clinical trials, that gets interesting, right? Because the question is, if you're doing a clinical trial, there's already, again, you're trying to, in some cases that technology would require there's FDA regulatory requirements, there's other requirements. So, what I tell you is that the small business program overall is really for all of our technologies, clinical trials or no, and that's that a phase 1 isn't required to have preliminary data, but just because something isn't required doesn't mean that you can't submit it, right? So we allow people to submit preliminary data for our phase 1. The fast track, as an aside, it is expected there will be clinical data. Sorry, it is expected there will be preliminary data, but it's not required, but it's expected for a competitive fast track. And then the direct to phase 2 requires it. Just as a quick side note, and I didn't get to this, not all institutes and centers support clinical trials through the small business program. And so it's really, really important to reach out and talk with your program officer or the person you expect will be the program officer associated with your technology. If you're not sure who that is, if you're not sure who to contact, you can reach out, but I'm going to put a link, see how quick I am here, but I'm going to put a link in the chat of all of our program contacts. I really encourage you to reach out because the clinical trials program announcements, and once you start talking clinical trials, it really does, that's the prime time to come out and talk to us. And I always recommend email to start with. For example, today I'm on this all afternoon. So I have been getting calls and I've been pushing them to voicemail. Email, on the other hand, I'll do this evening.
I have another question, Dr. Fertig. So I'm the CEO of my company, but as we go to conduct tests and human subject trial, I will also serve as the PI for that particular IRB. So IRB, I'll be the PI, and for the funding, I'll be the PI. Is there a conflict of interest? Because is there a conflict of interest, and if so, how do you resolve that, or how do you recommend that be resolved?
Again, that's really dependent on the specific situation that you have. And this is something that, again, you can reach out and talk with your program officer about, because this is something that most institutes and centers will talk to you about. I can speak from my own experience. We used to sit down and talk with the program officers and, I had a clinical trials team, and we would sit down and talk with the company, with the PI, and say, okay, how are you going to manage conflict of interest? Give us your plan, because we all see that there's a potential for conflict of interest here. So how are you planning to manage it to make sure that it is resolved? And oftentimes companies came to us with, again, based on their structure, based on who was on their teams, they had ways of managing that. And so I'd encourage you to just think of that ahead of time.
Okay, all right, thank you.
I did have a question in the chat, and I don't want to ignore the chat. The question was, must we disclose proprietary information in our SBIR research plan in order to show feasibility or strength of our proposal? And we get this question a lot, and this comes up, and I'm going to include a really clear kind of example, which is individuals who have a therapeutic and they don't want to put the full molecular structure in the application. They feel uncomfortable doing that, even if there's some initial intellectual property protection. You have to provide enough information in the application for the reviewers to review and look at your proposal. And so maybe it's not all the proprietary information, but you need to provide enough information that, say, if it is for a small molecule, a medicinal chemist might look at it and be able to say, yes, I can review it, and I see kind of, I have got the information that I need so that I'm able to speak about what's being proposed. And that is kind of, there is a delicate balance there, and I do really appreciate concerns around proprietary information. I'm not sure what's ringing behind me. But that is the real, that is the real issue. Very distracting. But that's a real issue. And again, I do really appreciate that that individuals have that concern. We do require confidentiality from our reviewers. It is not considered a disclosure with regards to intellectual property. But again, if you have concerns about intellectual property, I'm not an intellectual property lawyer. It's not what I do. I encourage you to reach out and talk with an intellectual property lawyer prior to applying.
I have a question.
Sure.
Okay, so I have a remedial question. I just want to know,
I'm not hearing the question. Am I the only one?
It got cut off.
Uh-oh, I think you might have gotten cut off.
I have a question in the meantime.
Okay.
Is NIH a good place to propose innovation and wellness?
Yeah, I mean, it really does depend on specifically what you're proposing, but we do have a specific institute that focuses on alternative therapies and on complementary and integrative health. And that is the National Center for Complementary and Integrative Health, NCCIH is that institute. But that said, I would also put out there that depending upon what you're proposing, that may actually fall in another institute. So prevention is an important part of what we do, and that could potentially be part of wellness. So it kind of depends on what you're doing, and not exactly connected to what you're doing, but I think it'll give you an idea of the depth and breadth of what we do. NIH did support the development of a new helmet material. Why? To help prevent traumatic brain injury. You would not normally think bike helmets for NIH, right? That might not be the first thing you think about, but in actual fact, we did support a bike helmet technology that is now for sale at Trek stores. So you can actually purchase it. I was recently at an outdoor store and saw it too. So I guess it's more than that, but so that is part of the prevention. So I think the key is really tying it to not just general wellness, but talking about biomedical outcomes, really talking about how it's connected to a disease or a disease state, or et cetera.
Okay, thank you.
I have another question. And I believe we've actually applied to NIH for 3 cycles now. And I guess I wanted more information about how the I guess sub-agencies like NIDDK or NHHS, or like, how do they make the decision on where your proposal gets pulled to? Especially if you have like synergy between 2 organizations, and is it always the one with the bigger funding, or like how does that work? And then I also have a follow-up question.
That's a great question. So what ends up happening is you submit your application to the National Institutes of Health. Actually, you're submitting to HHS.
Right.
When you come in through our omnibus solicitation, it also includes the FDA and CDC.
Mhm.
Our Center for Scientific Review takes a look at what you're proposing, and based on what you propose, then takes it and assigns it to a specific institute or center. Now that institute or center will look at it and determine if, there's a whole verification process behind the scenes. I will just say that, where institutes and centers make sure that applications are being assigned appropriately. Institutes and centers do have some overlapping mission areas. However, they've worked out who's going to take what. There is actually agreements between institute centers where they kind of determine what areas of research they cover within their mission versus another institute. So one institute will take primary assignment. Again, this is based all on what is in your specific aims. Has nothing to do with the budgets. Nothing to do with the budget of what you're proposing versus the budget of what the overall budget of the institute or center. Other institutes or centers may put themselves in as secondary. What does that mean? That means that they say, look, we have interest in this too. It may be a little bit more periphery to our mission, but we'd like to keep an eye on it. And if for some reason that first institute isn't able to fund it and we have some additional funding, we might. That doesn't happen very frequently, but that's one of the reasons why secondaries might be on there. It never hurts to have a secondary. Never hurts to have a secondary. But everyone will get a primary institute. So that's how that's determined, is really it's based on what's in your application. A really big misnomer everybody thinks, or a big myth, is everyone thinks institute and study section are 100% linked. There's one study section, and if I get assigned a different institute, I'm going to get a different study section. That's not actually true. Study sections have multiple institutes and centers in them. So for example, when I was at neurological disorders and stroke, the institutes and centers that had neurology, there were a number of them. And so when I would go and attend the study section, I would see applications from aging, from drug abuse, from mental health, from my institute, from all sorts of institutes. And it was really they would kind of put together those based on this broad general scientific area. Again, understanding that there is scientific overlap there. So don't think just because, if I change institutes, I'm going to get a different study section. That's actually not true. You may go to the same study section, and it is really going to be based on the content in your application. So I know that's a long answer, but I was trying to hit a couple of questions in there.
Very helpful. Next question. Sorry, I'm hugging. Last question though is letters of intent. I know there's 5, and I've heard the strongest. I just wanted you to verify if that was true. Is one from an investor, one from a possible customer, and then the others can be from collaborators or other users of the technology. Is that true? And if your collaborator is also a potential customer, can you not use them as a letter of intent in your application process?
So just as a quick correction, it's not a letter of intent. Those are letters of support.
Right. Yes. Sorry about that.
Just making sure, because I know one of the other agencies talked about letter of intent, and I didn't want anyone else to get confused.
Right.
So those are letters of support. We don't have prescripted numbers of letters of support.
Okay.
So it's really what makes, again, the most sense for what you're proposing. And so I think this kind of idea of, well, I need one that does this, I need one that does that, I need one that does this, isn't actually the case. It is more important to have good letters of support.
Okay.
That really show that, you definitely need letters of support from your collaborators. You need to show that, yes, they're actually interested in collaborating with you and they've signed on board and they're excited to be there. Other letters of support are important, but it's really important to have good, strong letters of support from your collaborators.
Okay, perfect. Thank you.
Any other questions? I know we have about 15 minutes left. I find it hard to believe there are no questions.
Hi, I have a question.
Sure.
So like NSF has something called I-Corp or PFI. Does NIH have similar programs?
We do. We have a number of programs, and I kind of zipped through those at the end. We have a number of ways that we help support innovators. Our I-Corp program is specifically for phase 1 SBIR and STTR awardees. So our I-Corp program is not pre-SBIR, STTR like NSF. It's actually once you get an award, you can go through I-Corp. In addition, we have entrepreneurs in residence that are available to our awardees. And again, we have a number of, we have a similar I-Corp-like program for devices, the C3I program. So we do have some additional ways that we can support our awardees. Pre-application, really that's about more applicant assistance. We don't have a specific I-Corp program that's pre-application.
Okay, thank you. So the reason I was asking this is that, you know, there's different ways how we all think about SBIR versus other programs, because some feel that we should have some results, some preliminary results before we can submit this. And some say you don't have to have results. So I'm kind of confused, like, do I first need to prove my proof of concept, or do I just use SBIR for my proof of concept? So I'm not very clear about the fine line between SBIR and other programs.
That's a great question. And it's made more complicated by the flexible definitions of feasibility versus full research and development. We intentionally cover a wide breadth of technology stages. We do that to provide the most flexibility for companies. In general, for a phase 1, you're not required to have preliminary data. However, you really do need a solid scientific rationale when you're coming in. You need to be able to show that this is the next logical step. You have a basis for what you're proposing. Now, it doesn't have to be your preliminary data, or it doesn't have to be, you know, you can be referencing other papers, but again, you have to show that you have the capability to do what's being proposed and that it's based on sound science. And I think that's where people then say, well, it's just easiest to do preliminary data. But for the phase 1, you're not required to have preliminary data. Now, that said, again, for a fast track, if you wanted to do that phase 1 and phase 2 application into one proposal, you would need, it's expected that a competitive fast track would have preliminary data, but again, it's not required. And a direct to phase 2, it's definitely required, because you have to show that we did the whole phase 1 already, and we don't need that phase 1, and we're going to go directly to phase 2. You definitely need to have preliminary data there. But for a phase 1, you know, it's really just showing scientific rationale.
Thank you so much.
Yeah, Dr. Fertig, the question I have now is from the time we submit to the time, let's say all of us are blessed with funding, it'll be about I guess around 4 to 6 months till we get that funding. So in that 4 to 6 months, as startups, we could have a potential of conducting the research that we propose, and some of it is done and some of it isn't done. So when we do get awarded, how do we balance that, and how do we communicate that properly to NIH?
Great question. It's probably closer to that 6-month mark, 6 to, in some cases, even 9 months, depending upon if you were on the bubble or not, and all sorts of different factors. So the first thing I would say is you do have pre-award spending authority. That's at your own risk. So there is an ability to spend on the grant prior to getting the award and then getting reimbursed. So pre-award spending authority is an option. However, it's really important to be back to your comment about how do we communicate this, communicating that with the program officer, with the grants management specialist. I should put in a quick plug for our grants management specialist. Everybody thinks of the program officers. The person who actually writes the checks is the grants management specialist.
Mhm.
Sometimes that delay is because people ignore the grants management specialist. They get a request from this, what they see, random person from NIH. They're asking me for information, but it's not my program officer, so I don't have to worry about it. Oh my goodness, it's the grants management specialist, the person who actually writes checks for NIH. Do not ignore that individual. You need that person. That's the individual to talk to about that. And that's, and really oftentimes having that conversation and saying, okay, we want pay award spending authority for this, and then we have this left to do. And you know, having that discussion is really important. And that's something you can talk to your program officer about. The good news is, after the summary statements are released, you'll have a good idea of where you stand and if you're likely to be funded.
Right.
And everybody gets a summary statement.
Yep.
Everybody gets that feedback from review, and generally your program officer will be able to tell you whether or not you're going to be considered for the second level of review at our advisory councils.
Okay. One more question that I have is, if I submitted an SBIR and it got declined and we received a score,
Mhm.
I don't want to resubmit that same, you know, I don't want to resubmit the same proposal, you know, modify it. Is there a time limit where it says, well, that's no longer a new proposal? You'd have to, because there's a resubmission and a submission check mark.
Right. And so there's a question of how much time, I mean, so I'm assuming this is, you want to know how long to resubmit, right? Not necessarily a new proposal, or?
Yeah, so yeah, what is that time of window? For my case, it's been like 1.5 years, 2 years. So is that too long? And I can just say this is not a resubmission?
So you can always say it's not a resubmission. You can always indicate that something is a new proposal if it's really, particularly if you've made substantial differences or there are substantial changes.
Okay, all right.
However, you have 30, I mean, generally the magic number on average at NIH is 37 months.
Okay, all right. Thank you very much.
I mean, if you're usually wondering how long do I have to submit,
Mhm.
generally, I mean,
Okay.
that is, it's 37 months. I usually tell people it is better to resubmit than to submit a new proposal unless you're vastly different, because you have a one-page letter to answer the reviewers. They have access to it. They can see that you've addressed the concerns. It generally resubmissions do better in review because you do have that feedback. I usually encourage resubmissions.
Okay, all right, thank you.
Now we have about 8 minutes left. This question between clinical trial and an observational study, and if you need an IRB for an observational study, I'm going to put in the comments our clinical trials definition. It's very important that you look at the definition for a clinical trial at NIH. The definition of a clinical trial at NIH is much broader than that for FDA. So just because something does not pass, you know, just because something, the FDA wouldn't consider something a clinical trial, doesn't mean we wouldn't consider it a clinical trial. So I strongly recommend you take a look at our definition for clinical trials and make sure that you don't fall under that clinical trial. Now, also in that link that I sent, there's a number of policy documents about human subjects research and just information about human subjects research and what's required. Oh, sorry, I just sent a direct message. I will resend that. So close. It's what I get for trying to do it as I'm talking. But there's the definition for a clinical trial. And off of that, you'll also find links to human subjects language, what's expected. And I'm gonna slip in here. Please, please, please read the instructions. I know they're 180 pages. I know they're long, I do, but they really do walk you step by step by what you need to do. And if you're not doing animal subjects, then that part of the instructions won't apply to you. Similarly, human subjects. So they do kind of provide information for each option, but I really encourage you to take a look at this. I get a lot of questions this time of year because the receipt date is fast approaching. I get a lot of questions that I'm going back and I'm referencing the instructions, right? So you have those instructions there. I really encourage you to take a look at those. You can get your answers much faster that way. In addition, I'm going to put some frequently asked questions at our SEED website. There is a frequently asked questions. I encourage you to take a look at those as well. Very, very helpful. We do try to compile all the questions that we receive. So that is, I definitely encourage you to take a look at that. I do see a question around pre-award spending authority, and I know we're wrapping up here. I am going to include in the chat the pre-award spending authority information for NIH. It does, pre-award spending is it is something that that do require NIH prior approval. It's something that you should discuss with your grants management specialist and program officer. I'm putting that information from the grants policy statement here, and you can see, you can read about pre-award spending. Grants policy statement, also a great place to go check out for answers to things. But I encourage you, as I said, as you're developing your application, the instructions are really, really helpful. Any other questions? I think we have about 5 minutes left.
So if nobody has a question, can I ask a follow-up question?
Sure.
So if we are not sure if the work we are proposing, it fits under one of the programs you mentioned, would it be a good idea to send an email with a short write-up, a paragraph or two?
That's a great question. So I would start with, remember that we are investigator initiated. So our omnibus solicitations cover our entire mission space. So if you fall within the mission of NIH, you fall within the omnibus solicitation. I think the one asterisk I would put there is clinical trials. If you're doing clinical trials, institutes may not accept clinical trials through the small business program, but they'll accept them in other ways. If you're not sure, if you're looking through the list of different institutes and centers and you fall between 2 institutes or you fall between 3 institutes, I'd encourage you to actually reach out to those 2 institutes. You can put both of them in the email. We're not offended. We all talk to each other anyway. It's actually a smaller community than you would think. So you can put both emails in there and say, hey, look, and I'm just going to make something up. I'm working on Alzheimer's disease research. I'm not sure if I'm neurological disorders and stroke or aging. Can you please tell me which one of you is likely to take primary assignment? And you can send it to both of those individuals that's in the contact list, and they would be able to help you. Now, if you're still not sure, you can email us at seed.nih.gov.
Thank you.
Sorry, that's the website. So it's seedinfo@nih.gov. There we go. And we have like 2 minutes left, but I think that's a great way to end, because if you do have additional questions, seedinfo@nih.gov is the best place to go to. Great. I'm surprised we haven't gotten a countdown on it. But I think we'll have a second session. And again, please feel free to take a look at the website, look at Seed Info. If you want even more information, I actually did a full webinar that's available on our website. It was recorded. I can put the link to that here as well. And I encourage you to take a look at that. It is, you get to hear me for an hour and a half, 2 hours. I don't know if that's motivational or not, probably not, but it still has a lot of information in it.